Maple syrup urine disease. Imagine changing your baby's diaper and suddenly thinking, why does this smell like pancakes? That's not brunch. That could be maple syrup urine disease, or MSUD. Yes, that's the real name. Here's what's happening. Our bodies usually break down certain amino acids, leucine, isoleucine, and valine, the building blocks of protein. But in MSUD, there's a DNA glitch that makes a broken enzyme, a tiny protein machine, responsible for this breakdown. So, those amino acids and their byproducts pile up in the body like traffic on a clogged freeway. One of those byproducts, a compound called sotalol, escapes through sweat, urine, and even earwax. And voila, a distinct sweet smell, often described as maple syrup or burnt sugar. Nurses and parents often catch the scent before the diagnosis. It's rare, about 1 in 185,000 births, but in certain communities, like Old Order Mennonites, the odds are much higher. Early diagnosis and a special low-protein diet can keep kids healthy. Sweet-smelling, yes. Harmless? Not without treatment. Pseudomonas infections. You walk into a hospital room and pick up the distinct smell of sweet grape flavor. Maybe the hospital is serving grape juice to everybody today? Or maybe they decided it was a good idea to switch to a new grape-scented cleaner. Nope, that sweet grape-like scent is actually a sign of a Pseudomonas infection, one of the strangest smelling bacterial infections out there. Here's the deal. Pseudomonas aeruginosa is a tough little bacterium that loves damp places like wounds and burns. As it grows, it cranks out a compound called 2-aminoacetophenone. And that little molecule? It smells uncannily like artificial grape candy, or some say taco chips. The rest isn't so sweet. Depending on where the bacteria take hold, it can cause greenish-blue pus in wounds, stubborn ear infections, or dangerous lung infections. Burn unit nurses can often tell when Pseudomonas is present just from the smell during dressing changes. It's not always obvious, but in heavy infections, even a faint grapey odor in breath or bandages can be the first clue something's wrong. Trimethylaminuria. You're in a crowded elevator. Someone walks in, and suddenly it smells like a fish market on a hot day. No, it's not lunch, but it could be trimethylaminuria, better known as Fish Odor Syndrome. Here's the science. When we eat foods rich in choline, think fish, eggs, beans, our gut bacteria make a compound called trimethylamine, or TMA. Normally, an enzyme in the liver, FMO3, scrubs that smell by breaking down TMA. But in people with trimethylaminuria, that enzyme is faulty. The TMA doesn't get neutralized, so it builds up and leaks out in sweat, breath, and even saliva. The result? A strong, unmistakable fishy odor that can carry across a room. Physically, they're healthy, but the social toll is massive, often leading to anxiety and isolation. And here's the kicker. Stress and hormones can make the smell even stronger. One notable story is of a UK woman, Kelly Fido White, featured in news media for bravely discussing how living with fish odor syndrome has affected her life and mental health. Phenylketonuria. You've tried everything. Showering multiple times a day, using different shampoos and body washes, even trying homemade deodorant. But you still smell like damp laundry all the time. That's the classic sign of phenylketonuria, or PKU, a genetic glitch with a very distinct odor. Here's the breakdown. Normally, the body uses an enzyme called phenylalanine hydroxylase to process the amino acid phenylalanine. But in PKU, that enzyme is MIA. Phenylalanine builds up, and the body converts it into phenylacetic acid, the compound behind that unmistakable musty, mouse-like smell in sweat and urine. Before newborn screening, PKU often went undiagnosed, leading to developmental delays and intellectual disability. It also led to people having lighter skin and hair because PKU disrupts melanin, the pigment that gives color to your hair, skin, and eyes. But thanks to early detection and a low phenylalanine diet, kids with PKU can grow up healthy and smell-free. Fun fact, PKU was first discovered in 1934 when a doctor literally followed his nose to the diagnosis. Science sometimes is all about sniffing around for clues. Typhoid fever. Picture a fever ward in the 1800s. Rows of beds lining a room. You hear people coughing, nurses chatting, and someone pushing a cart of supplies. Bet you weren't imagining the smell of freshly baked bread in a hospital. Well, that is the scent of typhoid fever, a systemic infection caused by Salmonella typhi that struck the world in the 1800s. Here's how it works. Typhoid kicks in with a high, lingering fever, stomach pain, crushing fatigue, and sometimes a faint rash called rose spots. And for reasons still not totally clear, some patients' sweat carried a smell like freshly baked brown bread. Was it amino acid metabolites? A shift in skin bacteria during high fever? Nobody knows for sure, but the smell was distinct enough that doctors used it as a diagnostic clue before lab tests existed. These days, typhoid is still common in parts of Asia and Africa, but modern antibiotics and better hygiene have taken the bread test out of medical playbooks. Back then, though, your nose was part of the exam. Multiple carboxylase deficiency. Imagine meeting a beautiful woman on a first date, only to wonder, did her cat pee on her? Is she a crazy cat lady? It might not actually be because of cats at all. That sharp, ammonia-like smell could point to multiple carboxylase deficiency, a rare but treatable metabolic hiccup. Here's the deal. Normally, your body uses biotin. Yep, the vitamin you see in hair and nail supplements, to keep certain enzymes running. In this disorder, because of a genetic glitch, those enzymes can't use biotin properly. The result? A traffic jam of organic acids building up in the body. Babies often show red, scaly rashes, hair loss, weak muscles, and sometimes seizures. And then there's that distinct odor, often compared to tomcat urine. Doctors aren't exactly sure which compound causes it, but it's strong enough to be unmistakable. Thankfully, there's a quick fix: high-dose biotin. With early diagnosis, now routine through newborn screening, the odor fades, symptoms vanish, and kids grow up healthy. Hawkinsinuria. Picture this. You're running on the treadmill at your YMCA and someone jumps on the machine next to you. He reeks of chlorine, but there's no pool at your gym. Did this guy douse himself in cleaning supplies just now? That bleachy, chlorine-like odor could be the calling card of Hawkinsinuria, one of the rarest metabolic quirks out there. Babies with Hawkinsinuria can't fully process tyrosine, an amino acid we get from protein in our food. Because of a mutation in an enzyme called HPPD, a strange metabolite called Hawkinsin builds up. This metabolite gives urine a smell eerily similar to swimming pool water. Symptoms usually appear around weaning age: metabolic acidosis, poor growth, even fine, sparse hair. But here's the wild part. Many kids grow out of it, living normal lives without strict diets after early childhood. With fewer than 20 cases ever reported, most doctors will never see it. But that unforgettable pool smell can be the clue that cracks the diagnosis. Diabetic Ketoacidosis. Imagine talking to a friend and catching a faint whiff of fruit. Not fresh fruit, so more like overripe apples left too long in the fruit bowl. That sweet, sharp scent? It could be diabetic ketoacidosis, or DKA, a dangerous complication of diabetes. Here's what's happening. When insulin levels crash, the body can't use sugar for energy. So it flips to emergency mode, burning fat instead. That process releases ketones, including acetone, the same stuff in nail polish remover. As ketones build up in the blood, they spill out through the lungs, giving breath that sweet, fruity, almost fermented smell. DKA doesn't stop at bad breath. It brings intense thirst, frequent urination, nausea, rapid breathing, confusion, and if untreated, it can be fatal. The smell, though? It's like a built-in warning system. Doctors, nurses, even trained dogs can pick it up instantly. It's your body saying, something's very wrong, help now. Tyrosinemia Type I. Picture this, you're at the movies, popcorn in hand, ready for the previews. Someone plops down in the seat next to you and, sniff? Wait a second, did someone bring boiled cabbage to the movies? Nope, it's Tyrosinemia Type I, a rare disease with a smell you'll never forget. Here's why it happens. Normally, your body uses an enzyme called FAH to break down the amino acid tyrosine. But in this disorder, that enzyme is missing. Toxic byproducts like succinylacetone pile up, and those compounds don't just stress out the liver and kidneys. They sneak out through sweat and urine, making everything smell like an abandoned cabbage pot. Symptoms kick in early: poor growth, vomiting, jaundice, even bleeding problems. If left untreated, it can lead to liver failure or cancer. The good news? Newborn screening now catches it early. With the right diet and a drug called nitasinone, kids grow up healthy and odor-free. Isovaleric Acidemia. You're out with one of your friends and you catch a strong whiff of sweaty socks. The friend says he showered before coming out, but he smells more like he just ran a marathon than the Old Spice body wash he says he uses. While your friend is most likely lying, he may also have Isovaleric Acidemia, a rare disease with an unforgettable signature: used gym socks and sweaty feet. Here's what's going on. Our bodies normally break down leucine, an amino acid found in protein, using an enzyme called IVD. In kids with this condition, that enzyme is basically on vacation. The result? Isovaleric acid builds up in their system and seeps out through sweat, breath, and even urine, spreading that funky, sweaty, cheesy odor. It's super rare. Only about 1 in 250,000 babies in the US are born with it. Doctors often first catch it by smell. Yep, their noses pick up what labs confirm. With treatment, like tweaking diet and using supplements to flush out the acid, the smell can fade. But during stress or illness, that footlocker aroma can sneak back. Fetor Hepaticus. You walk into a hospital room and there's this faint, sweet, musty smell in the air. It's not the usual cleaning product and rubbing alcohol kind of smell, more like a damp basement with a hint of overripe fruit. That's Fetor Hepaticus, the telltale breath odor of severe liver failure. Here's why. Your liver is basically the body's detox factory. But when it's in crisis, think advanced cirrhosis or severe hepatitis, that factory stops filtering out certain chemicals like dimethyl sulfide and other sulfur compounds. Those sneak into the bloodstream, linger in the air when you breathe out your lungs, and create that unforgettable sweet and musty scent. Some even describe it, rather dramatically, as a rotting garlic smell. It often shows up in late-stage liver disease alongside jaundice, confusion, and fluid buildup. Nurses in transplant units will tell you, once you've smelled it, you never forget it. It's not dangerous by itself, but it's the body's warning siren, a scent saying the liver is in real trouble. Methionine Malabsorption. Imagine this. You're playing with your friend's toddler when you catch a whiff that makes you ask, "Has this kid been drinking?" You've seen your fair share of drunk adults, and they do act like children, but kids don't usually smell like they're drunk. Well, that's the telltale sign of methionine malabsorption. Here's the scoop. Normally, the body absorbs methionine, an amino acid in protein. But in this rare condition, methionine just hangs out in the gut instead of getting absorbed. The gut bacteria take over, break it down, and send those byproducts into the bloodstream. And out through sweat and urine. Cue the beer-like aroma. Babies with this disorder often have poor growth and developmental delays, but it's the oddly hoppy smell that tips off doctors. It's incredibly rare today, thanks to newborn screening. But back in the day, sharp-nosed clinicians could diagnose it just by sniffing. Sometimes medicine really is part detective, part brewmaster. Olfactory reference syndrome. You're on the bus, someone nearby rubs their nose, and suddenly you're convinced it's you. You smell. Not just bad, but really bad. That's life with olfactory reference syndrome, or ORS. A disorder where the smell is all in your head, but the distress is painfully real. Here's how it works. ORS isn't physical. It's psychological, often linked to OCD or body dysmorphic disorder. People become convinced they're radiating a foul odor, maybe sweat, bad breath, or even just from their skin. Every glance, every sniff, every step back feels like proof. The reality? No smell, not a whiff. But the anxiety is crushing. People scrub their skin raw, drown themselves in perfumes, or avoid social contact altogether. Some even quit jobs or isolate themselves completely. Treatment helps. Therapy and certain medications can quiet the false signals. Because in ORS, the problem isn't the nose. It's the brain playing tricks on you. If you're curious about more strange quirks of the human body, check out our video on weird body glitches.